Alabama free CNA practice test with answers 180 questions full exam prep. Question 1. Which of the following is the nursing assistant most likely to observe in a resident who has low blood sugar? Option A, shakiness or trembling. Option B, thirst and dry mouth. Option C, sweet breath odor. Option D, increased urine output. The correct answer is option A, shakiness or trembling. Shakiness, sweating, and confusion are common early signs of hypoglycemia, or low blood sugar. Question 2. Residents are most likely to feel the urge to have a bowel movement at which time? Option A, after taking a nap. Option B, after eating a meal. Option C, just before bedtime. Option D, during the shift change. The correct answer is option B, after eating a meal. Eating stimulates the gastrocolic reflex, which often results in the urge to defecate shortly after a meal. Question 3. Before helping a resident to stand who has been lying in bed, the nursing assistant should do what? Option A, find out what the resident plans to do for the day. Option B, make sure a walker is available for support. Option C, ask if the resident has taken any medication recently. Option D, allow time for the resident to adjust to sitting at the edge of the bed. The correct answer is option D, allow time for the resident to adjust to sitting at the edge of the bed. Dangling the legs at the bedside prevents dizziness caused by orthostatic hypotension when moving from lying to standing. Question 4. While helping a resident get dressed, you notice their breathing is faster and they feel tired. What is your first action? Option A, address the resident quickly to get it over with. Option B, check the resident's vital signs. Option C, stop the dressing to let the resident rest. Option D, go to find a nurse to check the resident. The correct answer is option C, stop the dressing to let the resident rest. The immediate priority is to stop the exertion and allow the resident to recover their breath before continuing or seeking further help. Question 5. When planning priorities at the start of a shift, what is the most important task for a nursing assistant? Option A, decide break times with other nursing assistants. Option B, review assignments to check if residents are divided evenly. Option C, check all assigned residents to see if anyone has immediate needs. Option D, check what the activity department has scheduled. The correct answer is option C, check all assigned residents to see if anyone has immediate needs. The initial rounds allow the assistant to identify safety concerns or urgent care needs before beginning routine tasks. Question 6. A resident refuses to go for their scheduled walk at 10 a.m. What is the best response? Option A, maybe you can plan to walk a little further this afternoon. Option B, the doctor ordered your exercise and you really need to try. Option C, you have the right to refuse and I will tell the nurse. Option D, would you prefer to walk a little later? The correct answer is option D, would you prefer to walk a little later? Offering a choice in timing respects the resident's right to refuse while still encouraging them to meet their healthcare goals. Question 7. Which of the following is generally experienced by a resident with low blood sugar? Option A, fever. Option B, weakness. Option C, sour breath. Option D, frequent urination. The correct answer is option B, weakness. Low blood sugar deprives the body of energy, leading to symptoms like weakness, dizziness, and trembling. Question 8. An alert resident has requested to be left alone with her husband who is visiting. What should the nursing assistant do? Option A, allow the resident to be alone with her spouse. Option B, suggest that the husband take the resident home for a visit. Option C, explain that facility policies do not allow for this type of visiting. Option D, remind the resident that this is a nursing home and not a hotel. The correct answer is option A, allow the resident to be alone with her spouse. Residents have a legal right to private visits and intimacy with their spouses in a long-term care facility. Question 9. When a resident is dark-skinned, the first signs of skin breakdown may appear in which color? Option A, black. Option B, green. Option C, purple. Option D, white. The correct answer is option C, purple. In darker skin tones, redness may not be visible. Instead, look for purple, blue, or dark brown discolorations. Question 10. Which of the following foods are typically found on a high-protein diet? Option A, pasta and rice. Option B, meat and eggs. Option C, fruits and vegetables. Option D, whole grains and milk products. The correct answer is option B, meat and eggs. Protein is found in high concentrations in animal products like meat, eggs, and dairy, as well as in beans and nuts. Question 11. A resident says she is 5 feet 6 inches tall, but you measure her at 5 feet 4 inches. What should you do? Option A, record the height as 5 feet 4 inches. Option B, record the height as 5 feet 6 inches. Option C, explain that older people shrink with aging. Option D, measure the resident again. The correct answer is option D, measure the resident again. When there is a discrepancy between a report and a measurement, rechecking ensures the data is accurate before it is recorded. Question 12. The use of a physical restraint is intended to do what? Option A, control a resident's behavior. Option B, protect the resident from injury. Option C, make staff members' jobs easier. Option D, decrease how often staff need to check the resident. The correct answer is option B, protect the resident from injury. Restraints are safety devices used as a last resort to prevent a resident from harming themselves or others. Question 13. A resident with a hearing aid keeps asking you to repeat information. What should you do first? Option A is speak loudly and directly into the hearing aid. Option B, check that the hearing aid is in the correct ear. Option C, ask when the hearing aid battery was replaced. Option D, make sure the hearing aid is turned on. The correct answer is option D, make sure the hearing aid is turned on. Troubleshooting equipment begins with the most basic steps, such as checking for power and proper volume settings. Question 14. Where is the appropriate place for a thermometer to be kept for a resident in isolation? Option A, at the nurse's station. Option B, on the isolation cart outside the room. Option C, in the dirty utility room. Option D, in the resident's room. The correct answer is option D, in the resident's room. Keeping dedicated equipment in the isolation room prevents the transfer of pathogens to other areas of the facility. Question 15. What is the best reason for giving frequent perineal care to residents? Option A, it increases comfort. Option B, it decreases sexual responses. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence. The correct answer is option C, it helps prevent skin breakdown. Removing urine and feces is essential because the moisture and acidity of waste can quickly damage the skin. Question 16. The first step a nursing assistant should take when discovering a fire is to do what? Option A, check how quickly the fire is spreading. Option B, remove any residents near the fire. Option C, throw a blanket over the flames. Option D, pull the fire alarm. The correct answer is option B, remove any residents near the fire. The rescue, alarm, confine, extinguish acronym prioritizes the immediate safety of the residents. Question 17. To help prevent burns to residents during meals, the nursing assistant should do what? Option A, place a clothing protector on the resident. Option B, wait to serve the food until hot food is cold. Option C, add ice to any hot liquids like coffee or soup. Option D, let residents know which foods and beverages are hot. The correct answer is option D, let residents know which foods and beverages are hot. Effective communication helps residents handle their own meals safely while being aware of temperature risks. Question 18. A resident tells the nursing assistant about being bored. What should the assistant do? Option A, tell the resident that your days seem long too. Option B, ask the charge nurse if the resident can have some medication. Option C, ask about activities the resident has enjoyed in the past. Option D, tell the resident to check the activity schedule. The correct answer is option C, ask about activities the resident has enjoyed in the past. Engaging the resident in conversation about their interests helps identify personalized ways to improve their quality of life. Question 19. Why is it important to check the feet of a resident with diabetes at least once a day? Option A. To look for sores on the feet the resident may not feel. Option B. To check if vision problems have resulted in foot injuries. Option C. To trim the toenails so they do not become long or jagged. Option D. To make sure the resident does not get a foot fungus. The correct answer is option A. To look for sores on the feet the resident may not feel. Diabetes can cause nerve damage, meaning a resident might not feel an injury that could lead to a serious infection. Question 20. A resident's hands shake when trying to drink liquids. What is the best response? Option A. Thicken the liquid so it will not spill. Option B. Place a clothing protector on the resident. Option C. Seat the resident with others who also spill. Option D. Suggest the resident might do well with a cup with a lid. The correct answer is option D. Suggest the resident might do well with a cup with a lid. Using adaptive equipment like a lidded cup allows the resident to remain independent despite their tremors. Question 21. A confused resident needs more help with dressing today than usual. What should the nursing assistant do? Option A. Tell the resident not to feel bad about needing more help. Option B. Provide extra help as needed to avoid frustration. Option C. Ask if they would prefer to stay in night clothes for the day. Option D. Check if the resident will get dressed for another assistant. The correct answer is option B. Provide extra help as needed to avoid frustration. Care should be adapted to the resident's current functional level to maintain their emotional well-being. Question 22. A resident on bed rest needs a bedpan but cannot lift their hips. What is the best action? Option A. Ask the nurse if the resident should have a catheter. Option B. Turn the resident onto their side to place the bedpan. Option C. Place an underpad or brief to collect the urine. Option D. Have another assistant help lift the resident. The correct answer is option B. Turn the resident onto their side to place the bedpan. Rolling the resident is the safest and most comfortable way to place a bedpan for those with limited mobility. Question 23. A resident grabs his throat and cannot speak during mealtime. What should you do first? Option A. Try to get the resident to take a few sips of water. Option B. Provide abdominal thrusts from behind. Option C. Pat the back and reach in the mouth for the blockage. Option D. Ask the resident to take a deep breath and cough. The correct answer is option B. Provide abdominal thrusts from behind. Inability to speak and grabbing the throat indicate a complete airway obstruction requiring the Heimlich maneuver. Question 24. A resident is in rehab after a stroke and plans to return home. How can you best support them? Option A. Provide total care for the resident. Option B. Set high standards for the resident's achievements. Option C. Help the resident focus on even small accomplishments. Option D. Remind them they will be happier when they are home. The correct answer is option C. Help the resident focus on even small accomplishments. Positive reinforcement of small gains helps maintain the resident's motivation during the difficult recovery process. Question 25. A usually alert resident is having difficulty remembering where he is today. What should you do first? Option A. Increase the resident's fluids since dehydration causes confusion. Option B. Consider that memory loss is a normal part of aging. Option C. Ask where the resident believes he is. Option D. Report the change to the charge nurse. The correct answer is option D. Report the change to the charge nurse. Sudden confusion is not a normal part of aging and could indicate a medical emergency like an infection or stroke. Question 26. A resident has a finished seizure and is breathing. What should the nursing assistant do next? Option A. Get the emergency cart. Option B. Turn the resident onto her side. Option C. Check if the resident is able to talk. Option D. Help the resident back into the chair. The correct answer is option B. Turn the resident onto her side. The recovery position prevents the resident from choking on saliva or vomit after a seizure. Question 27. Which action shows correct handling of a urinary drainage bag for a resident in bed? Option A. Hang the bag higher than the level of the resident's bladder. Option B. Use the measurements on the bag to measure urine output. Option C. Or raise the bed to the highest position for drainage. Option D. Wear gloves when emptying the urinary drainage bag. The correct answer is option D. Wear gloves when emptying the urinary drainage bag. Standard precautions require gloves when handling body fluids to prevent the spread of infection. Question 28. A resident wears a hand splint. Which observation should you report to the nurse immediately? Option A. The resident's fingers are cold and blue in color. Option B. The splint was removed as scheduled in the care plan. Option C. The resident asks to have the splint removed for a few minutes. Option D. The resident asks to reposition the arm with the splint. The correct answer is option A. The resident's fingers are cold and blue in color. Discoloration and cold skin indicate that the splint is interfering with blood circulation. Question 29. Which statement is true about the effects of the aging process? Option A. The aging process can be reversed with good healthcare. Option B. Bladder incontinence is a normal part of aging. Option C. Joints tend to be less flexible as a person ages. Option D. Sensitivity to pain increases with age. The correct answer is option C. Joints tend to be less flexible as a person ages. Aging involves physiological changes including stiffer joints and a decrease in skin elasticity. Question 30. A resident is in restraints. What observation should be reported to the nurse immediately? Option A. The resident states that they do not like the device. Option B. The resident's position needs to be adjusted. Option C. The resident has suddenly become very agitated. Option D. The restraint was removed according to the schedule. The correct answer is option C. The resident has suddenly become very agitated. Sudden agitation in a restrained resident can lead to injury, strangulation, or increased physical stress. Question 31. While feeding a resident, you notice they are coughing a lot after each drink. What is the appropriate response? Option A. Allow the resident more time to swallow. Option B. Use a straw when giving the resident fluids. Option C. Add a thickening product to the fluids. Option D. Stop the feeding and ask a nurse to check the resident. The correct answer is option D. Stop the feeding and ask a nurse to check the resident. Persistent coughing is a primary sign of aspiration, which can lead to life-threatening pneumonia. Question 32. A resident has had only 50 milliliters of urine output in the last 6 hours. What should you do first? Option A. Begin offering the resident fluids every 15 minutes. Option B. Report the observation to the charge nurse immediately. Option C. Ask if the resident has pain when urinating. Option D. Check to see if the tubing is kinked or bent. The correct answer is option D. Check to see if the tubing is kinked or bent. Low output in a catheterized resident is often caused by a simple mechanical blockage in the tubing. Question 33. When caring for a comatose resident, the nursing assistant is expected to do what? Option A. Provide mouth care once a day. Option B. Avoid changing the resident's position. Option C. Talk to the resident while providing care. Option D. Keep the resident's room dark and quiet. The correct answer is option C. Talk to the resident while providing care. It is often believed that hearing is the last sense to leave. Talking to the resident provides comfort and dignity. Question 34. When a resident is not able to stand, how is their height usually measured? Option A. Having co-workers hold the resident upright. Option B. Adding the length of legs, chest, and head. Option C. Tasking the resident and subtracting an inch for age. Option D. Taking the measurement from head to heels while they are flat in bed. The correct answer is option D. Taking the measurement from head to heels while they are flat in bed. Measuring the resident while they are in a supine position ensures an accurate height for non-ambulatory patients. Question 35. A resident at the dining table begins to have a seizure. What should the assistant do next? Option A. Guide the resident from the chair to the floor. Option B. Remove the other residents away from the table. Option C, try to open the resident's mouth to check for food. Option D, keep the resident in the chair by holding their waist. The correct answer is option A. Guide the resident from the chair to the floor. Moving the resident to the floor prevents them from falling out of the chair and provides a safe space for the seizure to occur. Question 36. A resident says their food is poisoned and refuses to eat. What is the best response? Option A, offer to taste all the food first. Option B, report to the nurse that the resident is acting crazy. Option C, ask if there is something else the resident would like to eat. Option D, leave the resident alone because they will eat when hungry. The correct answer is option C. Ask if there is something else the resident would like to eat. Offering an alternative food item helps ensure the resident receives nutrition while respecting their current state of mind. Question 37. Which of the following is an example of the process of disinfection? Option A, washing a resident's hands after toileting. Option B, using a wipe to clean around a resident's stoma. Option C, cleaning a shower chair with a chemical cleanser. Option D, cleaning a resident's bath basin with soap after use. The correct answer is option C, cleaning a shower chair with a chemical cleanser. Disinfection involves using specialized chemicals to kill most microorganisms on equipment and surfaces. Question 38. Which of the following is a protected right of nursing home residents? Option A, to select the specific staff that will provide their care. Option B, to have designated smoking areas in the facility. Option C, to make decisions about their care and treatment. Option D, to have activities offered on every single shift. The correct answer is option C, to make decisions about their care and treatment. Autonomy in medical and personal decision-making is a core component of the resident's Bill of Rights.